No.
Or was there for something else before the thing happened, or went there specifically because that thing had happened? Which one was it?
The minister wasn't there when it happened, but when he heard it,
he went there.
Immediately went there.
Okay. Okay. So when the minister went there, so I think people know the story better than me. Okay. Nancy, because I realized that at some point the Ghana Registered Nurses and Midwives Association turned their attention away from Ralph, and the attention was on the minister because they said the minister had acted wrongly by shaking Ralph. What happened?
So the minister went there and met Ralph.
Okay.
And so they exchanged pleasantries.
Okay.
And that was the issue with the nurses.
Okay.
That this guy, we are saying that the guy has assaulted one of us.
Okay.
So why should you be shaking hands with him? Why should you be greeting him?
Okay.
You know, at the time when you saw him, because he was at the center of the issue, you should have called the police. In fact, you have a police following you. So you should have asked him to arrest him there and then, take him to the police station. And that was their agitation. That was what was agitating them.
Okay.
That the minister saw Ralph and then exchanged pleasantries, was smiling with him.
Okay.
They didn't like the idea.
So because they said that Ralph, at the time, their storyline was that Ralph attacked the nurse.
The lady, yes.
So much so that she suffered dislocation. And play the thing. He said what?
Two in front, two at the back.
No. That one I got it. But what did Tinkran play the short Tinkran voice again? Because that's important. Because you see, there's a difference between when and the whole thing seems it's not very. That's the way it is. So this is Tinkran.
Yes, they are calling. They say why? When you dislocation, they say we are here. Interna social and that's range mono. Omo piano she form that nipa it was a 4 efinity 2 efin one anim and omo bono.
Well, so what he's describing is not a small issue. So okay, so it's like as if 4 guys decide to attack Nancy.
Exactly.
And they never relented. Said they push her to the ground, and then you see, so for that dislocation to happen, and she was also saying that she dodged some blows and those things. Yes. So 2 in front, 2 at the back.
But you didn't know because with that form.
That description.
With that form, about say with that form, and I hear him. Into you didn't know dodgy. Didn't know dodgy.
Nurse for the crab your home granny. Of course, someone nurse in Tadia.
Yes. Yes.
But no. We not.
So there's a. You see, the narration when it comes to David Tinkran went far.
Yeah.
Went far. He said lots of things about exactly what happened.
Oh
yeah, they told him when he came. So what can I say? Maybe they told him when he came. So he said many things. But anyway, the real issue was whether or not this nurse suffered dislocation or was assaulted or beaten up. Because we must establish that first. If you see a nurse in that situation, because assault in any form is a crime. So if the crime is established, you take further steps. Because Ralph had also said he did not do any of the things that were being suggested. So this is Dr. Lawrence Ofori-Boadu, chairman of a committee that was set up by the health minister. The committee was supposed to look into the incident and find the facts. And this is what he had to say specifically on the matter of the dislocation. We'll come to the other things he said at a presser yesterday to present the report of the committee's work to the minister.
Committee also visited the nurse in question, the rotation nurse, Miss Chocho Rejoice, who was alleged to have been physically attacked and was receiving care at the hospital. When the committee visited, indeed, we saw the patient in bed. The document available to us from the medical record, as I already said, had no indication of fracture or dislocation of the said staff. And he has received some psychological support as well. The committee was able to chance on the specialist who also attended to her at the ward at the time he visited. And at that time, the staff had been discharged to go home and come for review. A police post that is found at the premise of the hospital, but situated far away from the emergency, is also of concern. And the system is that anytime they have such altercation, the hospital has to rely on Adabraka Police Command to call for help. And that's exactly what happened in this instance. The last but not the least objective was that the committee also found that the number of staff on duty per shift in the hospital was woefully inadequate. The number of medical officers in the month of August is 1 doctor per shift. That's 3 medical officers per day who are permanently working in emergency, supported by 1 specialist per day. Any other doctors who come there as a team to attend to cases and go away. A total of 7 medical officers and 2 specialists were available on duty for a month of August as emergency room permanent staff. We also found out that, for example, out of 88 nursing staff who routinely work at the emergency department every month, only 54 are currently on duty at posts, with about 34 of them already vacated posts for various reasons. This has brought extreme shortage in the number of nursing staff who also support the emergency medical doctors. Honorable Minister, apart from the 4 main things, there were other findings that we want to bring to your attention. The committee...
Well, so we'll go through those findings, the other findings. This is Dr. Ofori-Boadu again.
Also made another assertion that no patient was intentionally filmed or video or targeted as his recording, because everything he did was targeted toward the delay, and that he thought the committee and any other person must have that urgent concern to see. And the last submission we've had from his 6-pager report, that he has submitted 4 video exhibits, including a Facebook live video, as evidence to assist the committee, and the committee actually gone through and you have given a report in your recommendation. So, Honorable Minister, permit me to just make 1 or 2 recommendations, and the rest are found in your full report. With respect to Greater Accra Regional Hospital Emergency Department, that is REACH Emergency Department, it's imperative that the following measures must be considered at your Honorable Office as a matter of urgency to forestall any future recurrence. 1, we need to there must be improvement in security presence at the emergency, the ambulance triage area, by adding at least 1 personnel more at the gates and ensuring that the gates at the ED are always manned by security personnel. Additionally, we also propose that the CCTV cameras around is very limited to some of the care areas. And so we propose that if it is not for any privacy, they should add on some more CCTV to give evidence and also ensure that the staff will know that somebody is monitoring them in their work. Also, the police office present at the mortuary area, we propose that at least at the weekends or night duties, the police must be present to support the emergency security, to just back up the 2 private securities they have. Number 2, Honorable Minister, we also recommend that you take immediate steps to support the recruitment of additional clinical staff. For Greater Accra Regional Hospital, we focus on staff who will support emergency care. The next recommendation was that you also address to restore the capacity of Greater Accra Regional Hospital in providing imaging services. For example, X-ray, CT scan, MRI, which are all 40 at the moment. And we believe that is actually some of the gaps that is perceived to be delaying care at the emergency, even though doctors normally attend to clients on time. But the services for imaging is done outside. And then the 4th recommendation, Honorable Minister, was to appeal to your office to recruit additional administrative managers to serve as client service officers or customer care staff at the emergency department. We find that most of the time people come in there, but the customer care and client services is lacking. So people come in and get stranded, they don't know what to do. Whilst the emergency staff are also busily attending to patients. So we need to beef up the client service aspect of the emergency care. Other recommendations we added on Honorable Minister was to build human resource capacity for holistic emergency care in the country. This one goes beyond reach. And then when we are able to build that capacity for emergency care, it will minimize the rushing of people to the regional hospitals and then the pressure we are seeing now. We also recommend that we increase the number of secondary level facilities in every region. For example, Greater Accra may have 3 or 4 in addition to reach. And when these are done, it will also minimize the influx of emergencies all coming to reach, as we have been observing. We also recommend that we put measures in place to enable health facilities to acquire reasonably priced diagnosis or radiological equipment. That's what we call PPP arrangements, to facilitate timely patient care and reduce delays that needs referral to other places to to have investigation. The last but not the least, Honorable Minister, the committee recommend that you provide avenue for continuous engagement and sensitization to the public. Many a time, the public doesn't know what the emergency even does or what we do in the hospitals. So when they find themselves in that environment, they most of the time don't understand the dynamics. So we believe that if you have any avenue to educate public on radio, on television, or the ministry, it will be an avenue to allay fears and also educate the public on what the self people do. The last but not the least, we also want to look at the implementing agency, the Ghana Health Service, must immediately effect or support the nationwide emergency care. Their activity of building a customer care must be intensified, and then also ensure that our health staffs actually adhere to the protocols of the profession. This will bring back the perceived loss of confidence the community may have in emergency services in the country. In conclusion, Honorable Minister, the above mentioned observations and recommendations may be addressed to prevent any set occurrences, as we have said, in our health facilities, Greater Accra region and Ghana at large. So the committee ended by saying that we support all the few things that we have proposed. There must be a training for security presence at all emergencies. Government or the ministry must address shortages of health staff, re-equipment, retooling of health facilities on diagnostic tools is very critical. And we believe that the committee is so grateful, Honorable Minister, for the opportunity given to us to serve. On that note, we want to say a very big thank you.
Well, thank you to Dr. Lawrence Ofori-Boadu, chairman of the committee that was set up by the Minister for Health. Now, the interesting thing is that most of those recommendations goes beyond what happened at the Ridge Hospital. Now, one thing you must admit that there's always pressure on three particular hospitals, Ridge, 37, and Korle Bu. So those three hospitals, there's always pressure on them. One of the hospitals that was supposed to help out is a police hospital, but they've been building a police hospital for like 75 years. In fact, they've been doing some work on the police hospital. I came, I've not been in Accra for too long, but I've been in Accra long enough to see that they are still not making, they have put another team there that they are going to do something else, whereas they haven't finished the first one. So they are saying that you need to reduce the pressure on these facilities. Yes, that I agree with. There's too much pressure on those facilities. UGMC is a quaternary or something, so it's not a place that you can just rush people to. Korle Bu was also supposed to be same, but has become an emergency. So there's a need to have facilities, more facilities that are able to deal with all type of emergencies. There's also the part about, if you look at, and then see if you go to the Ridge Hospital sometimes, even simple tests, they'll send you to some Ridge Medical, something that's a few meters away from them. About a kilometer or something from them.
The SU building you're talking about?
Yes, SU building.
Okay.
And I don't know why. First, I thought it belonged to them because I expected a facility of that nature to be able to take care of some of those tests. Those were simple, basic tests. It is not anything complicated that they decide to do.
That's a private facility.
Yeah, there's a private, so you pay a private man for something that should have gone for money that should have gone to the state to go to give it to a private man. So they need to deal with that. The imaging matter, I've heard that story of how they have an imaging machine, got spoiled. They brought in a private person who came to install his own, and the imaging too doesn't work, among others. There's a whole story around some of the things that have happened at Ridge over the period. So that's another issue. But we'll go into that. But the issue that we want to talk about is the issue that is at hand, is the story. The story that was told on the day. Was that story accurate? What impression were those who were telling that story seeking to create? Anyway, this is the health minister. In fact, I'm
going to take my time. We'll have a committee in place, and then we'll digest it one after the other and see to the full implementation. But at a glance and on hearing you, most of them we have already started working on it, and people who have monitored the media space will attest to the fact that I've on several occasions mentioned PPP, retooling of our health facilities and all that. So it fits well into government priority areas, and that we'll continue to do whatever it takes to improve upon the health sector of this country. And I'm very sure that we may not be able to make it perfect, but we'll improve upon it. And we are not going to put this report or recommendations on the shelves. Immediately, we are going to start implementing them. This is a fact-finding committee. They are not to prosecute, they are not to judge. They have presented their report. It's a fact-finding report that anybody can make good use of their report. And so, with the greatest of respect, let us now go into the criminal issue of the matter. That was not within their jurisdiction. In fact, the truth of the matter is that the very day we visited the hospital, which of course I was accused of greeting somebody, that very day I gave that instruction that they should look at the internal security. And I had the opportunity to also speak to the police. So some of these things have already started and they are in motion. Yeah. So I just want to give the public that confidence, that impression that, even if a committee is established, that's all. Only the announcement of the committee is what we hear. We don't hear the findings. Nothing happens to it. That's not going to be business as usual. In fact, I will also challenge you that whatever recommendation that has come, you also follow up to see that whether or not it's been implemented. I will challenge you to also do that. So this has absolutely nothing to do with the criminal issue or the case in court. And we never try to comment on any case in court or any criminal proceedings. This has no bearing, absolutely nothing. This is to guide us as a ministry. So the most important thing is to help us to improve upon the system. That is the most important thing.
Well, so that's the Minister for Health, Komna Minta Kando. He's not had the most, what do I call it, of relationships with the Ghana Registered Nurses and Midwives Association.
That association, do they have a spokesperson?
Yes, the PR. I've spoken to him once. Oh, okay. Yes, I've spoken to him once. But in every association or group, for example, in the NDC party, when General Mosquito is speaking, it takes prominence over the spokesperson. Yeah. So everything the chairman, general secretary say takes prominence over there. So they are also spokespersons. That person has a special, but their voice is the voice of the institution. Okay. So that is the GRNMA position. Okay. So Nancy, yes, please go through the findings again, because it's important for the sake of the facts, especially the facts of what happened on the day.
Okay, so this is the report. But before that, I just want to inform you that Dr. Bawumia will be filing today.
Oh, nice.